And when we were talking about it, we just talk about where the spinal cord ends and where you go, and people are saying 3 to 5, and this young lady think that 4 wasn't right. But still between 3 to 5. You see, there she's still with it. Oh, God, right. All right.
4 was right, but this is what I know you told me.
All
3
right,
to
so
5.
basically, with ALS, the person who gets it, it's kind of hard on that person. Why do you think it's going to be kind of hard for that person?
Because it's the twist of
The
the
muscle
muscles.
weak. It
The
became
weakness.
Because they know that they're dying.
Right.
They know that nothing can be done for them.
Depression.
And so what do you think? They're going to be thinking, and then as the disease progresses, now they kind of brush their teeth and they realize that soon they can't breathe any longer and they're going to stop breathing. And that alone
That's a slow
that'll
death.
mess up their mind. Right? Because there's no cure.
That's the worst way to go.
And it's just sad to say, it is a very
Slow.
degenerative disease. And it is a fatal. If you come across all the other diseases, normally you talk about fatal, you talk about deadly, right?
Yeah.
And usually when you use the word fatal these days, fatal means a person dead. Now they go about to die. They dead. Person was fatally shot. They died. Car accident, was hit by a car. Fatal accident, the person died. So when you have a fatal disease, you know that's it.
Death, yeah.
That's it.
Yeah.
And unfortunately, 90 to 95% of the people who get it,
Why people live forever?
they don't know how to get it.
Good people
Just
that
about
die.
5% will say, maybe they get it from family or something of the sort. But most people don't know they have it. All right? On nursing considerations, go with your ad pie. Whatever the person is presenting with, that's what you're going to work with. And then you got to work not just with the actual. The actual, it's going to be weakness. You're going to have problems with the falling and all that sort of stuff. But what is some potential? Because remember, when you're doing your care plan, you have the actual, what is going on right now, and what will happen later on. Because this disease is what? Progressive. And it's going to get progressively worse. So you're looking at the symptoms now getting worse. So what is going to be happening next? What you have to do as a nurse. What are the things you have to plan for that will eventually happen? In this case, it's not maybe. It will eventually happen. Once a person's alive, it will happen until they pass away. So you've got to have a potential. Not just talk about what's going on with them right now. You have to go look into their future a little. Are you guys good? Now, persons, like the medications, we're talking about adverse effect and all that sort of stuff.
Yeah.
There's no treatment. There's no treatment.
But in 2017, they had this medication they started using.
They're trying all kinds of stuff, but there's no treatment. And most things they're going to do is try to maintain what that person
Quality
has
of life.
until
They
they can't
go.
do it any longer. Just keep going and going and going.
And gone.
All right? ALS,
Now she's an event planner. She's probably ready to go do the event.
it's another of the sclerosis.
Yeah.
And when we're
She
going to
hustling
be
to pay
doing,
the school fees.
ALS is sclerosis, right? Lateral. And the MS is the multiple sclerosis, right? So what that tells you right away, we got to talk about two things with sclerosis in it. So what is sclerosis?
Sclerosis, hardening. Yeah, you said that. Yeah, hardening.
Somebody read sclerosis.
Define sclerosis.
Sclerosis means
Abnormal hardening of body tissues.
want to hear the remaining one.
Yes.
Sclerosis means excessive resistance to change.
I just read it. Abnormal hardening of body tissue.
Alright. Look at, just to clarify, let's go to MS.
Multiple sclerosis.
Define multiple sclerosis.
What do you guys do?
It means
Alright, give the
chronic,
presentation.
typically progressive disease involving damage to the sheaths of nerve cells in the brain and spinal cord, whose symptoms may include numbness, impairment of speech and of muscular
Then say
coordination,
nobody want to see him.
and severe fatigue.
Let me get my Shane back. Huh? Like that, Shane?
Is on MS. It's a disease that affects the CNS system, which is central nervous system. So this disease attacks the myelin sheath, which is the protective layer around the nerve fibers. And it causes inflammation and lesions. It makes it difficult for the brain to send signals to the rest of the body. It's a autoimmune disease in which the immune system attacks cells in the brain and the spinal cord. So the symptoms include tingling, sensation, and numbness. There's no cure for MS. How you can diagnose it? They may do blood tests to rule out any other diseases, a spinal tap, which is lumbar puncture, what we just discussed, to check the pressure in the CNS. This test also helps identify inflammation or bacterial infection. Or they may do an MRI to check MS lesions on the brain and the spinal cord. Eventually, the disease can cause permanent damage or deterioration of the nerves. Some people that I work with MS, I notice that they lose their ability to walk independently on their own. Numbness or weakness in more than one limbs that typically occurs on one side of your body at one time, or your legs and trunk. They may have electric shock sensations that occur with certain neck movements, especially bending the neck. Tremors, lack of coordination, unsteady gait, slurred speech, fatigue, dizziness, tingling, pain, parts of your body, problems with sexual, bowel, and bladder functions. As far as when you work with patients with MS, you can instruct them to perform everyday exercises that are both helpful to strengthen and stretch muscles, and you can teach them to perform stretch or relax activities to reduce muscle spasms and contractions. They can apply ice packs to minimize the spasms and advise them to take rest periods. You can do things to reduce fatigue, like encourage to use techniques that conserve energy, such as sitting while doing some activities and pushing or pulling objects instead of lifting them up. And have them make a plan of activities of every day. I just personally noticed because I worked with people with MS before. Make a plan of activities for them each day. Make sure they have enough rest periods in between activities. Enhance sensory functions, like because I think I believe it can affect their eyes, like they can get blurry vision. So we can recommend to make use of an eye patch, because they may get double vision. and orient your surroundings.
Mhm.
Keep personal belongings, furniture, in a fixed arrangement. Make sure that area is clutter-free and safe environment. And when it comes to like maintaining urinary elimination, I see some people they use a catheter to expel retained urine. Ensure adequate hydration to protect urinary tract infection and stones. Set up a bladder training program to lessen incontinence. Any questions?
It's quite different. Yesterday I have to commend you guys and job well done. But today I got kicked off
Why?
why? Because yesterday's presentation was everybody was involved as a group. And everybody did something. Today's different. Today is one person talking to the group.
Actually, my group assist. My group,
No,
my group assisted me.
Guys, no rationalizing. Yesterday, group 2 and group 3, everybody got together and each person did something. Isn't that so? Guys, wasn't that so yesterday?
Yes.
Each person did something. Group 1 had a little flop. I think you guys catch up in it later on. That's what you're supposed to do, right?
Yeah.
So I'm wondering why you're going back today.
I got a question for them though. I
No,
got a check.
that's not question. You're talking the presentation, the group,
I got a
where
question.
everybody being involved, everybody having a voice, everybody having to say something, and talk about it, and not just one person summarizing it for the group.
Oh, they're not finished.
That's
They got more.
They got well. She wasn't talking about the risk factor.
all right, then let me go. Go on, sorry, they're not
Oh,
finished.
God.
Because she said she was finished, any questions? So
I'm personally finished.
No, then you're wrong. You can't say any question just for you, it's a group presentation. And when the group is finished, then you say, any questions, and then you guys will take it. All right, guys, so don't do that the next time.
Yes.
All right?
No, we working.
All right, Jim, you wanna go now? We are waiting. We are all waiting.
They're waiting for next time.
Wait, the medication?
Mhm.
The risk factor included smoking, certain infection. Women are more likely to develop than men. It's aged between 20 to 40 are at risk. Really?
I mean, that's information that's very pertinent.
Yeah.
Like women will develop more or more than men, which is important to know. Okay, the age factors also important to know. But the thing is that when you get together as a group, that's why I said yesterday was so beautiful, is that everybody was able to participate, and then persons were able to ask questions of the group. And that is what I'm looking for. I don't want us to go back. I want us to move forward.
I never said we was all
She
finished. I'm talking about.
She basically cover everything, so I'm like, you know.
Every person have a say, but the thing is not to be redundant. Redundant is when you repeat something that somebody else already have said. You don't want to be redundant. You want to share new information pertaining to the same topic.
Yeah, I kind of have a new information,
Okay,
something that
so-
she don't really
All right,
mention.
so we're listening.
Yeah, so basically, it's one form of it of MS. It's relapsing remitting. That's up there. We can see it. So basically, the patient might have the symptom, and
That's
suddenly, like you can't whether find whether if it's diagnosed with MS or not, because it's really varying, because it might have the symptom today, and the next day, like, you just showing it nothing, like no symptoms or anything like that. But, like she said, causes unknown, it's not curable, and you can change your lifestyle. That's one of the things when you do it. And you can get some meds and stuff. There's nothing you can really do about it.
What are some of the lifestyle changes?
Yeah, how can you
It
change your
gets
lifestyle?
progressively worse, right?
Say that again?
Even with treatment, it gets progressively.
I've seen people with MS who get worse.
I'm getting my
Don't
back
get better.
That's stability center.
And the thing that you should know about it's like it's different in everybody. Like let's say you might have it, but we experience different symptoms because it might affect a different nerve or in your body than mine. So you might let's say you kind of attack your optic nerve. So you might have problem with your vision and stuff, but me, it's different. Like you might attack, my cerebellum, nerve, which is have to do with my tremors,
So
this social
Hard questions, right?
like speech.
It's true that I know the
So the
optic nerve.
So the symptoms can be different for
Stacy.
different people.
Yeah.
The symptoms can be different.
Different.
Yeah, for it depends, how you affect.
The symptoms are different for people, but I read something about it's very different from men and women. Is that can you clear?
Yeah, it can be. Yeah, it can be.
This is what
I
you
think,
meant.
What I mentioned
They
earlier.
said for the men it's different from the women.
Yeah.
This will be
It's
different
affect
symptom
man
for me.
more
You're
than
different, you have a different symptom.
I got a question.
But most likely they said it affect the optic nerves.
Yeah, it's wood.
yeah,
I got a question.
Which of the following
question.
is not?
I got a question.
yeah.
Ask me the question right here. Which of the following
Oh Lord.
is not a typical manifestation of multiple sclerosis? Double vision, sudden burst of energy, weakness in the extremities,
What is that?
or muscle tremors.
All of them.
That's it.
Yes.
That was 73. The answer is 2, 3, and 4.
Exactly. All you mentioned.
All right, guys.
They're all part of the nerve.
All right, guys.
I'm sorry, that was the
With
answer
multiple
was 2.
sclerosis, it affects their neurons, right?
Mhm.
And if you notice with both the ALS and the multiple sclerosis, you have a situation whereby persons were losing control of body,
Functions.
especially their voluntary muscles.
Mhm.
You're not having that thing. And then eventually when it moves on to involuntary muscles is where some of your breathing and what have you can be affected. But with MS, what's different with ALS, one of the things you want to look, see if there's any mental status changes for MS patients.
Oh yes, definitely.
Depression.
As
They
opposed,
investigate depression.
not just depression, check and see mental status changes from multiple sclerosis. ALS, there was none. Person was able to think clearly.
What are the mental status changes for a person with multiple sclerosis?
I found this on the web.
Yeah. Which one do you have?
We got depression, we got anxiety, pseudo bubbler effects.
But whatever treatment they put you on, it's just a type of kind of like keeping you know how
When they put you on treatment when there's no cure, it's mainly to enhance the life of the person.
but that's what I was gonna
All
ask
right,
you.
you're gonna find that persons, and what one of the things that when we do ALS that we should have talked about, or is that persons who have ALS, and we know that the actual problem and the potential problem, what it is. And usually, because this is a fatal disease, this person should be going into hospice. Start off first with palliative care, and then into hospice.
Mm-hmm.
I got. You said the side. What you said mental effect for multiple sclerosis.
Right.
I saw.
Hold that thought.
All right.
Just to go back again with the ALS,
Mm-hmm.
because it's such a progressive disease and it's so fatal, you want to give this person special care when you start it first. And what is the special care? You want to go to palliative care first, which is increasing comfort care.
Mm-hmm.
And then when it gets increasingly worse, you're going to move on from palliative to hospice.
Mm-hmm.
All right, so keep this in mind. As these progresses, care changes. All right?
I was under the assumption that palliative care and hospice care was the same thing.
No, it's not.
No, it's not.
Absolutely not.
It make them comfortable.
When you start working in facilities, you will find things like visiting nurse services, VNS, and what have you, will come in to do hospice care. And they'll send a companion to be with that person. All right? And the facility itself don't really be that involved because they take over for the hospice. But when it's palliative care, the facility still continue to take care of this patient, but what you do, you get to give them a little more comfort care. But when you look at some of them, they put it as just I call it documentation purposes, because they want it to look good for when the state visit or what have you, that look, this is, but they don't really, it's just a care that's called palliative. It's just like everybody else. But in the records, it's in the patient is on palliative. But when you look at it, there's no much of a difference. It's just same damn thing you're doing to the patient. But it looks good. And then when they come in to review, the person's on palliative, you're doing what's right, but
Make it
give me a break. The only time you know is when you go to hospice, and facilities do not like to put patients in hospice because now payment is going directly to VNS, and they don't really. It's not good to
Their business. Yeah, some of them don't do anything.
Right, but the facility,
No, my job they keep
they're losing the money that will be for taking care of that patient.
It's metropolitan.
It's different. How does that work?
And for actually that, I'm glad you said that, because with the patient with ALS, they prefer to have this patient at home. Because there's not much you can do for this patient.
Right.
So let the patient be in an environment that they're very familiar with.
Right.
Instead of keeping them around, you
They
know.
sent her to hospice, and the mom said they didn't have a they would go to the clinic, and she was like, no, I don't want to be here, I'm not comfortable here.
Right, you
So
could go home.
they said, to hospice at home.
Right. And one of the things that you look at also, when everything in America is payment, right? Who's going to pay for the care?
Mm-hmm.
So that's the first thing you got to look at. What type of
Insurance.
managed care she has? But insurance.
Compensation.
When you care for the parents, you can get paid. I forgot what.
Freedom
Freedom care.
Freedom care.
No, it's not free. Freedom Care is not the agency, but it's called CDPAP.
CDPAP, that's the
So
name.
it's
Like you
CDPAP,
can have
you
someone
can-
at home,
Mm-hmm.
and you.
Don't take CDPAP. It's crazy because CDPAP is whereby you will be taking care of your loved one at home, but they will be only giving you a certain amount of hours.
4 hours.
It depends, because that's one. That is dependent on who, because that's what I used to do until last year before this Renaissance has come around.
It depends on the severity of the situation.
For home care, so I used to go in and decide how much hours a person should be getting.
Mm-hmm.
So I look at the family situation, look at the environmental situation, and then I decide and I recommend how much hours that
Patient need.
right, the agency or the family or whoever it will get. And normally when you work it out, unless that person have a really debilitating disease, that can actually be like a two-person. Most times you just give them 4 hours. 4 hours.
4 hours can pay
8
my
hours
bills.
is a lot. Because you really want to do that. Again, because when you're doing the planning, I have to go through like breakfast, lunch, dinner, how she gets it, who does laundry. All these things I have to sit down and go through. And I hate it.
But what are the rates though? How much do I get paid an hour?
It's not much.
$16.
Not much. So
They pay
but if you
$18.
have somebody at home who can move around and you don't have to be looking at her or what have you.
Mm-hmm.
I see some guys is be for their mother and that sort of stuff, and you know, hey, the mother doing everything for herself. And when I go now, because I got to do assessment, annual assessment.
She has to
And when I
start.
walk in annual assessment, all of a sudden the mother can't walk.
Can't do
Hi.
nothing.
I'm serious. Time to hit the time you see the mother walking, and then all of a sudden, oh my God. Now bring me the kid. Cause she come and sit up.
But
I left the kid.
I have a lady, she's with my mom, but her daughter care for her. And then my mom always at her house because when the nurses come in, she go cook. And then one day I had to go back and then I see the lady cook, do everything by herself. Then I see Timothy, they call it Timothy. Timothy can even get Timothy.
Some guys are going there, those guys are there for disability, they're like this in the bed. Can somebody bring me something? I just this is that. Let me see a bathroom. Is that right? You got any bars in your bathroom? Let me see what cooking and you got any rats or mice in this place? And I'm out today and I'm gone.
Yeah, but it's because they want to give the family more hours. When they do things like that, she said
They always ask me, when I go in, I used to ask, can we have another hour, can we have 2 more hours? I was, my usual thing is, look, I'm doing assessment, when I send to the office, they will decide. If
That's
they're gonna
right.
give you or not. Because I'm not gonna tell them I'll give you out when I know they ain't gonna get it. So they need
8
to find out
hours.
to them.
It's 8 hours. It makes more
Alright guys,
sense.
let's move on.
16 hours.
No, 16
Multiple
hours.
sclerosis. And we know just so we said was hardening, sclerosis is hardening of there.
Tissue.
Tissue.
The neurons. Let's go again. What is sclerosis? Hardening. of-
Hardening of the tissue, the body tissue.
So how does this affect the disease process? Is it the body tissues or are we talking about the arteries? I mean, the arteries, the neurons.
The
The
neurons.
neuron.
And what's happening to the nerves?
They're becoming demyelinated.
Either way.
The myelin sheath,
Yeah,
that
either way.
protective layer,
Yeah.
gone.
It's gone. It's not there no more.
Not no hardening there now. Destruction of that. So I just want you guys to understand, because you guys keep saying hardening,
Get a
hardening.
visual.
Be understanding that the myelin sheath is a protective sheet that covers the. So when this sheet is gone, it's like you have an electrical wire. Exactly that is what
Yes,
happens in the
it's
brain.
open.
You have the electrical wire, and if there, you know that
There's a
protective
piece
tissue,
coming
which
out.
is the insulation.
The
That comes
plastic
off.
will cover it.
What happens?
You're gonna
Electricity can go.
It don't
You
go
get
no more.
shock, right?
Yeah,
Yes.
yeah, shot.
The same thing saying on
On your brain.
abnormal electrical impulses around your brain,
Mm-hmm.
and that's what screw you over. All right, the demyelinization of this. But guys, and do
the
please
myelin
remember
sheet thing.
when you look at your neurons. In fact, look at your
This is what
image of your neuron right now, please.
Show me an image of the neurons.
Look at the neuron. Look at
Here are some
the
images of the neurons from the web.
where's the axon, where's the dendrites.
That's what I call a neuron right there.
Look at the myelin sheet.
It's a neuron. Okay?
What is the axon? Come on.
An axon?
Yeah, AXION.
Let me ask.
What is an axon?
You guys did this before.
Here's some information.
again.
So come on, what's the axion? So you gotta know these things
Nervous
because
fiber
this is
fibers
what is
along.
being
that's what conducts the impulse.
Mm-hmm.
The,
It's a
the,
long
axon.
slender
axon.
section of nervous cells.
the nerve impulses. So nerve fiber
Look at that.
conducts electrical impulses known as action potential away from the nerve cell body.
action potential away from the nerve cell body. Now look at, you see dendrites?
Dendrites.
What is the
Receive.
dendrite?
That's what receives. That's what receives the impulse.
I know, I'm asking you guys, so tell me what you have because we did this before.
Yes,
Yeah.
it's receive
And this
the
is supposed to be
impulse.
just
Refresher.
review,
Yeah.
refresher. So pull it up for me, please.
What is a dendrite?
Receive nerve impulse
what I
from
found.
other cells.
Dendrite, also known as dendrons, a branched protoplasmic extension of a nerve cell that propagates the electrochemical stimulation received from other neural cells to the cell body.
It's basically having, from when the axons and the electrical impulses, it's moving from one neuron to another.
To the
That's
next,
all.
yeah, simple.
So you gotta have that connection. It's like you have your, what is it, the phone line?
Electricity.
And the phone line get cut.
That's
Nothing
it.
going on,
No
right?
connection.
Yes.
Same thing.
Can't pay the bills, don't cut
And I
anyway.
remember everything in your brain. I remember what we're looking at is your CNS, your central
Nervous system,
which is your
brain, and the spinal
and the
cord.
spinal cord.
Mhm.
And everything you've done, the two things that you'll be talking about until now, which is no cure, progressive disease, it's the brain, right? All right. What did number 2 group did?
Why can't it be one? Only
You can
one.
only do one. You're cheating. You only do
Only
one.
one, only one.
Can't do more than one. Oh, okay.
Oh, you're PNS.
Oh,
you're-
okay,
all right.
okay,
The
okay.
peripheralness.
All right, go ahead. Sorry about that.
I'm sorry too.
Okay, PNS Guillain-Barré syndrome, which is a rare disorder in which your body immune system attacks your nerves. Diagnosis of Guillain-Barré syndrome can be difficult to diagnose in its earlier stage. Its signs and symptoms are similar to those of other neurological disorders and may vary from person to person. Your doctor is likely to start with a medical history throughout physical examination. The doctor will recommend spinal tap, which is a number puncture. It's a small amount of fluid is withdrawn from the spinal canal in your lower back. The fluid is tested for types of changes that commonly occurs in people who have Guillain-Barré syndrome. EMG is the electromyography. It's a thin needle. Electrolytes are inserted into the muscle. Your doctor wants the electrolytes measure nerve activities in the muscle. The nerve conduction studies, the electrolytes are taped to the skin above your nerve. Is a small shock is passed through the nerve to measure the speed of the nerve, the sign of Guillain-Barré syndrome.
I'm not blind.
After the first signs and symptoms, the condition tends to progressively worsen. About 2 weeks, symptoms reach plateau. Within 4 weeks, recovery usually lasts 6 to 12 months. Throughout, for some people, it takes as long as 3 years. It can most people eventually make a full recovery from Guillain-Barré syndrome.
To 3 years.
But it is this can sometimes take a longer time, and around 1 to 5, around 1 in 5, people have long-term problems. The vast majority of people recover in a year. People may have symptoms again years later, but this is rare. And Amber will take up with the
Okay, guys, I'm just gonna talk about the treatment to Guillain-Barré syndrome. And it is not, there is no cure for it. There is a treatment that out there, most commonly used is intravenous immunoglobulin.
Immunoglobulin.
I'm sorry, globulin. It's a treatment made from donating blood that contains healthy antibodies. It actually helps to fight germs and diseases. It's also, it contains healthy antibodies. These are given to help stop the harmful antibodies damaging your nerves. There's another word that I looked up called plasma exchange.
I don't know about that. Can you get off?
No, back up now.
Plasma
I
exchange.
wanna go pee.
That's something else that they use. That's another word for intravenous.
Okay, so let me just stop you right there for a moment. Ask a question. Is there a cure for Guillain-Barré syndrome? Ask the question, guys. Check it, please. Can Guillain-Barré be cured?
Is there a cure for Guillain-Barré syndrome?
No.
Is there a cure for Guillain-Barré syndrome?
Anybody, please?
No.
I said no. Some people can recover.
There's recovery, but there's no cure. 95% of people recover, but it's not cured.
So what do you mean by recovery?
It's like when a person has the flu, you know? There's no cure for the flu. You're just gonna recover from it after it runs its course.
You just recover from the
Like people become temporarily paralyzed.
symptoms again, they come up with the symptoms. That's when you only get the flu, and like every year something you get the flu season.
All right, let's just look at something here. Let's see. What is Guillain-Barré syndrome? Oh, sorry. Turn the lights on, guys.
It's a rare
Have a seat,
disorder.
that's good.
It's an autoimmune disorder.
There's a rare autoimmune disorder in which a person's own immune system damages the nerves, causing muscle weakness and sometimes paralysis. And when you can think of another autoimmune disorder, you can think also of what?
MS,
ALS.
ALS. But ALS is autoimmune? I don't think ALS is autoimmune.
Guys are mixing things up now.
I know multiple sclerosis is.
Is it Parkinson's?
No, all I'm gonna say is MS. MS only. Definitely MS.
There is rheumatoid arthritis.
What is it?
Right.
What is the question?
Any other autoimmune disease.
What causes rheumatoid arthritis? Come on,
Bone
let's check it.
disease.
What causes
Infection.
No,
No,
inflammation.
please. Guys, just what causes rheumatoid arthritis?
You remember we done it?
So tell him. Answer. Tell him.
It was inflammation.
What causes rheumatoid arthritis?
Go and look.
What?
No.
What causes rheumatoid arthritis?
So it's a combination of genetic and environmental factors. So
Autoimmune condition.
So it's autoimmune.
Immune system that
Stop, guys, stop. All right, listen to me carefully. One of the things we go with EBP, right? Evidence-based practice. Don't you taking things and mix it up. Rheumatoid arthritis and then osteoarthritis recently as we were doing bones. One, we talk about the degeneration of the joints, and the other one's the autoimmune response. So why am I sitting here and hearing you guys talking other stuff and thinking what have you, and come on guys, come on. That's why I make you check things, so you can read and see for yourself. Do not just talk. Don't talk off the top of your head the way you think it is. This is an autoimmune response. That's why the whole treatment is so different. And remember, you got to treat the underlying cause. Not all arthritis is the same thing. One you can have total hip replacement done. One can have total knee replacement done. Why? Please, don't mix them up. I'm finding you guys are mixing little things up. Let's stay focused on what you're doing, all right? Don't mix them up. All right, so the thing about this Guillain-Barré syndrome, you want to remember, right? So what is Guillain-Barré syndrome? He said, a personal new damage to nerves causing muscle weakness and sometimes paralysis. GBS can cause symptoms last for a few weeks to several years. Most people recover fully, but some have permanent nerve damage. Some people have died of GBS. So most people do what?
Recover fully.
Fully recovered.
And some of them die.
Fully recovered.
And some die.
Meaning they continue with their normal activity
of living.
Lifestyle. Okay? What are the symptoms? People with GBS usually first experience weakness or a tingling sensation in both legs. And start with the legs. This is why they say it is an ascending. Ascending means it is going up.
Going down, up, yeah.
And that's how you identify this problem. It's an ascending neuromuscular disorder. It's going up and not going down. Right? So you know there's certain specific things you can say. Like yesterday when we talked about the hydrocephalus, what's the thing that we kind of look at and push our fingers out? What sign did we look at? We know the head gets big, but what else did we look at? Go again, Farrell. Go. Why are you looking at them? Forget about them. Look at me.
The eyes.
The eyes.
What about the eyes?
They got
the moon color.
The sunset.
There you go. The sunset phenomenon. And you know right away, that's the eyes. So there are specific things that can act. So that's where you go to the differential diagnosis. When you have things with similar something, and most of the nervous system have what? Fatigue, weakness, paralysis, and what have you. There are things that can define what a disease is. And with Guillain-Barré syndrome, it's the ascending weakness. All right, starting with the legs. All right. Symptom increase until symptoms can be used at all, and in severe cases, the person can become paralyzed. Symptoms progress over hours, days, or weeks, and weakness typically peaks within the first 2 weeks after symptoms appear. Recovery may take as little as a few weeks or as long as a few years. Now, what causes it? Several things are known to trigger GBS. About 2/3 of people with GBS had diarrhea or a respiratory illness several weeks before developing symptoms. Infection with the Campylobacter jejuni, which causes diarrhea, is one of the most common risk factors for GBS. People also can develop GBS after some other infections such as cytomegalovirus, Epstein-Barr virus, and the Zika virus. Very rarely, people have developed GBS in days or weeks after receiving certain vaccines. They want to make it very clear, because you know what's going on right now. People are saying that people are getting ill because of receiving what? Vaccines. Okay, and they want to make it very clear that vaccines is not what's coming. Even when you listen on the radio and the TV, you hear everything they're doing is trying to get people to understand that vaccines are not causing all this stuff. In fact, while I was driving this morning, I was listening to one that's indicated that people are saying that when you get a vaccine, they put microchips in you, and your body then becomes your body becomes magnetic. And all that sort of stuff. And people really do believe that.
They do that.
And so with the people believing that, a lot of people is not taking it. The good thing about it is here in New York State, we have 83% of all New Yorkers have taken it. That's one of the highest for all the states, one of the highest. And for the healthcare providers, it's 90-something percent. So most of the healthcare workers have taken it because they know they're taking it, they ain't got a job. Right.
A lot of people don't take it.
5% who have got
a lot do.
Exemption because of
medical
health
situation.
And religious exemptions. Okay? Now, we just understand that this could come from certain diseases that you get, right? Diseases can be both bacteria, can be virus. But I want you guys to look at something else too. And see, let me see if I can find it. Guillain-Barré syndrome, as it's related to, let's see. This is very important, very interesting. Can you guys read up here?
Yeah. Want me to read it? Guillain-Barré syndrome associated with COVID-19 vaccination. Arthur Keeling Chang Memorial Hospital.
No, that's the people who did the thing, and that could be the abstract.
You have any more candy?
No, thank you. No, the lady not here. Yes, I'm
CDC, sorry Tom, but I want to get something that's more clean to you guys so that you don't. That's some CDC.
Oh, so sleepy. It's cold. It's hard to sleep when it's cold. Oh, you like it cold? When you sleep, just to go to sleep? You said you needed it. That's why I gave it to you. I'm sleeping. I need something to stay up. You have coffee? What did you say? What did you say? I can't hear you. Okay.
I'm thirsty.
Okay.
All right. Oh, now before I go to the Guillain-Barré syndrome and COVID-19, let me just take you back to over here. We're looking at ALS, right?
Mm-hmm.
And with the ALS, we went to Johns Hopkins, right? All the ALS, the MS, the Parkinson's, all are at from.org or CDC.gov. All right? CDC.gov, that is the government. But when you pick on something, you usually go with.
.org or .gov or .edu.
So, in knowing this, like just now we look at this ALS, neuromuscular disease, what we have up here.
American Brain Foundation.org.
Brainfoundation.org. What causes. Sorry. Hello?
It's so loud.
I know, and I saw your message this morning, but I didn't want to disturb you. Okay.
That's really good.
I
put
so
Windows in my
down here?
computer.
You there?
I put Windows in my MacBook.
How do you do that?
Yeah, you have to be a site. You have to be a
No, it's okay. I
computer
just want to
major.
ensure because when you guys come back then I'll take care of it. Just want to
But that's not a MacBook. You can't do
I
it
know
on
that
a
nobody's
tablet.
going to go there, so you know, for security reasons.
Anybody want
So
it?
just want to know nobody's supposed to be there. All right, gotcha.
Okay, you gotta take care of me first, okay? After you take care of me, I'll take care of you.
You guys will be back on Sunday. And the dogs. All right. So once nobody else come in there, I know that they're not supposed to be there. All right. So I got you. Give me a call. All right. Thank you so much. All right. All right. All right. Sorry about that.
It's okay. It's okay.
Security and situation. All right. What's the last thing you're talking about?
We're talking about the .org and ALS.
Right. Like for the ALS, we were looking at some of the problems that you can get, and I looked, I think, at Johns Hopkins, but if you look, see the foundation. One of the best places to look for any information that's related to the disease process, you go to a foundation. If you have a foundation for, let's say, give me a foundation quick.
A foundation?
Any foundation.
St.
They will
Jude.
have the most recent information. When you do your research, always go to foundation. The foundations got lots of information that other places will not have. Because remember, they have all the different support groups and organizations and what have you. So when you're doing research, go to foundation. And the foundation is usually a .org. Okay? Like how we look at this one up here.
Organization.
Okay. Now the American Brain Foundation. See that? American Brain, because you know the brain is part of your CNS. It will give you more information than others, those .coms and what have you, to say that is very nice. Correct? I don't know what happened today with because remember I told you guys when you're looking at videos, you should look at what? Very short videos. See, there's another .org here. Okay? www.als.org. That is just wonderful. Crystal ALS. You get excited. That's it. So when you're looking up, try to avoid those .com. Just go to org. Go to foundation, and you're going to be good.
Best sites are .edu.
Right? So
Yeah.
There's the window.
anything you do
Huh?
research
The
on,
window.
all right?
That's
Always
Windows,
go
that's
to the
Windows.
source.
Which one?
Because when they, remember, when you go to foundations, the foundations are getting information for their what? Their members.
Mm-hmm.
And their members and people who actually are what? Suffering with the disease.
Mm-hmm.
So they will come up with what is the latest
Treatments.
treatments and what have you. And you now will get that information and you know this information. And because you may be reading your books and the books don't have it because the books have not got that information. Isn't this hot in here? My hot.
No, it
No,
is
it's
hot.
nice. It's nice in here.
Oh,
It's
yeah.
nice in here right now.
It's good.
Leave it, leave it, leave it. Leave it, Mr. West.
No.
It's good. It's
Mr.
just
West.
right.
Majority say leave it.
Just
Right
right.
now, we kicking 75.
That's good.
Good.
That's perfect. I'm still cold.
But why you put so much clothes? Every day you're hot.
Client pay for response for pain, right? Feel bad. Stern rough. Referral. Pressure on the veterans.
Don't come up here with the aging process and tell everybody anything. You don't want to do it. All right? Old people feel cold.
That's hot.
That's me.
And the only person who's old, as we say, yes, is me.
Me.
Because it's dye my beard, and dye my eyelash, and dye everything. I don't want to know.
Tell about this thing. After you ask the question, right or wrong,
So if you're not like
we'll
me,
give you the test taking
that's
strategy.
appropriate.
I know
Right?
that. They tell you what to eliminate, why to eliminate, why is the right answer, why the wrong answer.
All right.
I gotta give it a
So,
rationale.
you guys understand the ALS, right?
Yes, sir.
It's PNS. As she was saying. Peripheral nervous system. It has nothing to do with your.
Central nervous
But you
system.
see, not saying this is what? What's the difference you get between the, you just did two on the other side. Now you go to the other side, one the other side. What have you noticed is the difference?
It's from your nerve.
One.
Come on.
No.
I'm gonna ask you guys to stand up now if you guys don't come and start thinking, because you're sitting here not thinking. What's the difference between the two? Come on, show me what you think is the
The
difference.
ALS and MS.
What's the difference between the CNS disorders and the PNS
PNS.
disorders? Guys, why are you making me break it down that simple?
CNS, the brain and the
The-
spinal cord
is
is
a
being
bit-
attacked.
Attacked by who?
By the disease. By the whatever disease, the nerve.
So the PNS, what's happening to the PNS? They don't get no attack.
The
No, the PNS, the PNS, they don't get no attack.
I feel like the
The
difference.
body. It's attack the body.
It wasn't attack the brain, it wasn't attack the body, right?
No, it's a
So
bigger
the
one.
PNS, no attacks?
No, I didn't say.
The CNS, I feel like I see that it's the PNS one, it can manage it better than the CNS one. The CNS one is more fatal.
Fatal. Yes, because
Guys, what we're looking at, very simple. With the CNS, it's a progressive disease. Mean it's what? It's getting worse.
And worse.
Whereas with the PNS,
Yeah,
with the Guillain-Barré, the person recovers within a week or two.
It's a
Right.
Sometimes they
descending.
take years, but
Yeah.
it's what?
It
They
was
recover.
They
Yes,
get
it's
well.
descending, right?
But with the
CNS is more
Rico was
progressive
trying to
and
explain
fatal.
when you were doing what you guys did. MS, right?
But PNS you recover
Tell the difference between the different types.
and fatal.
The
And
relapsing,
CNS and PNS you recover.
That's please. With the relapsing,
Remain.
you're gonna have it there, and then in 2 weeks it will go away. But it comes right back.
Send me that.
And then go on. Relapsing, remitting.
Yeah.
Okay? So you have relapsing, remitting situation. It goes away, it comes back. It goes away, it comes back. But when it comes back and it stays, it now is no longer remitting, relapsing. It is now secondary.
Okay.
Secondary stage.
But if it had started and it had just continued getting worse, it is primary.
When I was
So-
doing my research, so they say like, if you caught it earlier, there's a possibility that you can treat it before it gets worse.
You can initiate anything at all that you get. When you pick it up early, you can slow down certain things, possibility, but not
Tape?
cure it. There's no cure. And will get progressively worse. Right. But you identified early, so you can put things in place for this person, so that as time go by, they will,
I
do
recorded
what
it.
is necessary to start get accustomed to certain things happening, right? Like we have not touched yet. We kind of touched on Parkinson's before, right? Parkinson's is another way called demyelinization of the what?
Parkinson, the bone, right? Parkinson, something about
MS,
the bone.
the MS, sorry. The multiple sclerosis is the demyelinization
Of the myelin sheets.
myelin sheets.
Right, right.
The this Guillain-Barré syndrome can happen after any type of what? Disease. Remember, you got something that's happening in the bladder. Anything that's happening in where? Viruses like cold, the flu, Zika virus they give you can be a risk factor for person getting their Guillain-Barré syndrome.
Mr. West, I'm sorry to take you back, but you mentioned something about the second stage. If it goes to stage 2, and then you said if it starts from the beginning and it gets progressive worse.
Right.
I didn't quite.
Most persons who get MS will get this sporadic thing, which is called remitting, relapsing. That you get it, the disease process, and you have the signs and symptoms, and then it goes away. But then it comes back. It goes away. And it varies, the time varies. It could be weeks, it could be months, but the time varies. But it goes back, the person goes back to normal. And goes back and back and forth. But then when it reaches a point now where it just continue, it's no more going back and forth, it just continue on and on and on. They said they now have gone into the secondary stage.
Got it. Okay, I got it now.
But if they had started off and it did not go away
And come back.
and come back, but it just continue to get worse, that is the primary stage. And that's how it's easily identified.
Oh, okay. Of course, with MS repeating themselves like 3 times, because my pastor wife has MS, and every time she comes up on the podium to say something, she repeats everything 3 times.
Maybe she's trying to make you guys remember what she's talking about.
Yeah, my pastor does the same thing.
Because there's no reason why she should say 3 times.
Everything 3 times.
Yeah, my pastor does the same thing. Yeah. CCC. Yeah, he does that, right? Yeah, he does that.
Repeat things 3 times.
No, A.R. Bernard does the same thing.
No, he doesn't.
Yeah, he does.
Who?
A.R. Bernard, he repeats it 3 times. He said, I want you guys to really understand. I'm going to say it again. 3 times.
But she does the same, but I heard they had a recording.
All right, don't hear what nobody. We're talking about what's right now,
Okay,
right?
but no.
If a person is saying, like you're saying, the person's everything she repeats 3 times.
But she has MS, that's what I'm
Right.
saying.
They're not losing their mind.
What do you get with the MS?
You're not losing your mind.
Right? That's the thing
You
you
have
got
all
to
your
what
sense.
happens to the MS. You get a weakness, you get some
Yeah.
problems that come with the nervous system. But it's not going to be a person going
You
to say
have good sense.
3 times they repeat something is a sign of MS.
Nope.
No, that's
No,
nothing to
that's
do
why
with
I'm
MS.
asking you. I didn't research it.
No, what I'm saying, it has nothing to do with MS.
Okay.
Once it has the person 3 times you want to say it, it's
Started.
maybe it's to get it across to people
Yes, to
who
make
are
sure
listening
that
to
you
something to tell them, they don't understand it. So you're going to repeat it again and repeat it again.
Stuttering.
There are some people who have MS And they're functioning,
Like one tell me.
right? But they start to get worse over a period of time. But some persons do well, you know, and they're
You maintain.
right? Some of them do have some changes, they get upset, angry. And at one time they're like, cool, another time they're like,
You gonna say something?
screw you or
Can't
something
say
like
all of
that.
it. We gotta go through it together. It's a lot of questions. I try to go through all the questions though, so I can like have a good foundation. So 197 questions.
All right,
You were
you live in
neurological alone.
25, again, it depends on the person, that has it. And you can specifically say because they need to be a male or female. And the type of work that they're doing, job involvement, right? And keeping the, for instance, if you don't keep your muscles active, like how you do,
Disuse atrophy.
they will have, not disuse, but if you notice every one of those progressive diseases, they said you need to do what? Involved in some kind of exercise.
Range of
Right,
motion.
maintain something going. It's like, it's very funny. I was looking at a video 2 days ago of these guys that would be in the park. You know, every time you pass by a park, you see these guys doing this pull-up.
Yeah.
Like one day I went to the park and I said, oh shit, these guys can do this pull-up. I jump up there and I stay right up there. I couldn't come up. I jump up and I come down and walk in my pocket. I don't want nobody to know. I couldn't do it. So I just walk away like this. But I was looking at a video of a guy. This guy was jumping up here, and then the guy was spinning around, pushing his feet out straight in this hole like that, do all kinds of stuff.
You think you could do it too?
And the guy was 70 years
Yeah,
old.
no, 60. He was 60.
No, they've got 70.
No,
The guy's 70. That's what I'm telling the guy.
Maybe it's more than one person.
The guy said 70.
wow.
As a black guy, and this man got scrubbing boards like yesterday,
Yeah.
muscular.
Got a 10-pack.
And I look at this guy and I was like,
Then he
he's 70.
exercise.
Do not know that this guy look like anywhere close to 70. His body's got muscles and all
Right,
these
yeah.
things cut and
Mm-hmm.
and I just went like, hold on, I
That's
don't know back. So, I guess if you keep doing it, what I'm trying to get across to you, if you keep doing exercises,
Yep.
it will maintain. Sometimes there's something that you call muscle memory.
Mm-hmm.
Things that you used to do before, like you used to do ballet, so you're going to end up doing like a plie or a tattoo, and up you say, oh my God, how you do that? Muscle memory, right? So it's good to maintain and continue doing certain things, including exercise.
They said that it's hard to diagnose.
Yes. ALS, there's nothing for ALS.
No.
No.
Nothing. Right? But one of the things that we said with the, you know, you can look up the use of the LP, lung puncture, right, spinal tap. It's just basically what they're doing. Remember yesterday we talked about the cerebrospinal fluid?
Mm-hmm.
And we said, what did we say the cerebrospinal fluid do for you?
And
What does the cerebrospinal fluid do for you?
Kush.
What he does for you?
When your eyes open up big, you look at me.
You know,
Cerebrospinal fluid, we said buffers, right?
right. So the burning on what
Right?
each other.
But it also carries what? Waste. And,
Okay.
and that sort of stuff. And nutrients and that sort. It got other purposes. It does not buffer. Remember we went through that? Right? And if you get any type of disease, those guys will be inside there. So if you get the virus and you take out the spine, you're going to see it in the lab. That's why they do the spinal tap or the lumbar puncture.
Okay.
Because you want to know what's going on in the brain, what is affecting the brain.
Okay.
And with the Parkinson's, I ask you guys to read. So the time, so this is general now. With the Parkinson's, we said a person could get Parkinson's disease. How? How do you get Parkinson's disease? And somebody did it, one of you guys did yesterday. You have a problem with the what? What area of the brain? A specific area of the brain. The same area actually is be affected with the Guillain-Barré syndrome.
The left side of the brain.
No left side. Don't just stop. What part of the brain?
Excuse me, repeat the question for me, please.
Parkinson's disease. What part of the brain is affected? All right. What part of that brain that's responsible for the dopamine? And so you have to start taking what? Levodopa. Because it needed. So tell me what part of the brain? Hey, stop it, you gotta be. See what part of the brain, please.
Let me see.
Because that is what defines this disease. The part of the brain that's affected.
Look it up.
Parkinson's disease, what part of the brain?
What causes Parkinson's disease? What? It's more to that.
Basal ganglia. The nerves in the basal ganglia. Let's see. Look it up right now. I'm .org in it. .gov in it.
Please find the basal ganglia and look at your brain. Look for the basal ganglia. Just put what is a basal ganglia.
I said that. I said basal ganglia.
BASALGANGLIA. Basal ganglia. And you're gonna understand how with the dopamine and all that's coming. Get to your laptop. What are you doing?
One clear risk for Parkinson is age, although in most people with Parkinson develop. What is the cause of Parkinson's disease? Occurs when a nerve cell in the basal ganglia, an area of the brain that controls movement, becomes impaired or dies. Is an area of the brain that controls movements. And if it can become impaired or die.
Okay.
Normally, these nerve cells or neurons produce an important brain chemical known as dopamine.
All right, full stop.
Yeah.
That's what you need to know.
Okay.
So when you use a drug, pharmacology, you know why? Right? Because the basal ganglia has a problem. And so the basal ganglia is not producing the what?
The dopamine.
And what does dopamine do for you?
Helps you to move, right?
Let's look. Yeah. Go. Look at tell yourself right now.
I'm gonna get it right now. Dopamine.
What does dopamine do?
It's a type of neurotransmitter. What?
It influences your mood and feeling of reward and motivation. What does dopamine do? Dopamine is an important brain chemical that influences your mood and feelings of reward and motivation. It helps regulate body movement as well. As well.
But you know the nice feeling you get?
Yeah.
When somebody give you something and you like it?
That's dopamine.
Dopamine.
That's dopamine.
Alright? It is not just about
good feelings.
That's why you go to the ganglia. That's why you got to know what the ganglia is. Don't just say, Parkinson's disease is a problem with the brain. It's what part of the brain is affected. And how does that part of the brain, when it's affected, how it will affect the person. So now the ganglia, which is responsible for the production of the dopamine, if it gets damaged, the dopamine production is going to
go down.
And that means now you're going to have changes in mental status. Changes in body movements. You guys with me?
Got you.
Alright? Don't just stay at the top of the surface. Go down, see what's in there.
Go deeper.
So when they ask you and they tell you why you got to use levodopa, you know why. Because you got to replace.
It's a synthetic form of the dopamine.
There you go, guys. It's easy like that.
Very easy.
Like that. Alright? You alright? Be quiet today.
Thank God.
Your sister been messing with you? The turkey. You put your turkeys down already?
Yes.
Was it you put it in the refrigerator in the
Season it up.
No.
I don't celebrate that.
Haitians soak their turkey.
Let's
with
celebrate the
lime.
genocide of Indians. That's
for
what-
about like 2 days or something like that before, right? Because last year, my job gave me a turkey.
I could eat turkey every
I've
day. I don't
never
need
cooked in
Thanksgiving
my
for
life. And I said, everything can be done if you just go on YouTube or whatever. So I went to YouTube.
The
and I
Haitian
did everything they tell me I'm supposed to do. Season, do all the stuff I buy. And I was so proud, man. I did all of that. Got a nice, the container that you put
Steam
it
it for
in.
2
I
hours.
put it into the oven, put the time and all. I already had said like for a day or two. I put it, they say season after that, stay for a while. I did all of that. Put it in the refrigerator, had it there, and then I took it out.
Yes.
Put it inside the oven.
Yes.
After warm to the necessary heat. And it got to bake slowly
Yes.
a long period of time.
Yes.
I fall asleep.
Did you burn it?
Goodbye to the next morning.
No good. No good.
That was it. Turkey was over.
Oh God! You do all
I
the
know
job
that
for
you have
nothing.
to go. I served the gun.
But you have
to come back, take that crap out, do something with the fluid, I think, and
Yeah. You don't have to do that. Certain thing you do, you don't have to do that.
All right, anyway. I hope you guys turkey's good. Enjoy.
My only question is this, Mr. Weiss. My only question is this:
That's it.
what do you do with the inside white of the turkey that has no taste? The inside white has no taste.
Turkey is very hard.
Use cranberries.
Sure, the outside tastes good, but when you go inside, it tastes like bread.
Haitian turkey. Haitian baked turkey. Yes.
Okay. All right, I'm gonna try
The
that.
white
Not a
one
Haitian
tasty.
turkey, a Haitian baked turkey.
Yes.
Not a Haitian turkey.
Haitian baked turkey.
Just a ordinary turkey.
I just cut my turkey in fry.
That's why, that's how.
You just cut your turkey and fry. You're the right one.
I bake it. Because my children like to see, they are American, they like to see the turkey sit down at the table.
We fry for them. My sister and I fry every year, but she want the leg, mom want the leg, and I want the leg. We always fry.
My son said he's happy, we're gonna have it at the table.
All right, so the ganglia of your brain
That's what's working. It's telling you what to do
give you that nice feeling.
with that turkey.
And if that nice feeling is not there, you're gonna have a problem, right? All right.
So,
Dopamine.
Where you get damage to that area. That's where the Parkinson's thing come in. And with Parkinson's, remember when we spoke about Parkinson's? Up there? One triple for other is for Parkinson's
Turn the
age.
light off, Mercedes. Turn the light off.
Let me see here. Ah, Lord have mercy. I'm sleeping.
I'm gonna stick on you.
Hey, look at Farrell's Lord.
I snore loud.
All right, so we go to NIH, which is the National Institute on Aging.
Of aging.
Okay, and Parkinson's disease, a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. Parkinson's
Symptoms usually begin gradually and get worse over time.
Now, as the disease progresses, people may have difficulty walking and talking.
Talking.
They may also have
Have
mental and behavioral
changes.
Mental,
Sleep
because remember
problems.
we just talked about the ganglia and the mood.
And the
So if
dopamine.
the dopamine is affecting the mood, then
Yeah.
you're gonna have that problem, right?
Sleep problems,
depression, memory difficulties, and
fatigue.
Now, both men and women can have Parkinson's disease. Heart disease affects almost 50% more men than women, so men are more at risk. Now, one clear risk factor for Parkinson's is age. Although most people with Parkinson's first develop the disease about age 60, about 5 to 10% of people with Parkinson's disease have early onset disease, which begins before the age of 50. Early onset forms of Parkinson's are often, but not always, inherited.
As some
Bear with me
forms
with this one. Early is usually inherited. And some forms have been linked to specific gene mutation. Now, what causes Parkinson's disease? Parkinson's disease occurs when nerve cells in the basal ganglia and area of the brain that controls movement become impaired and or die. Normally, these nerve cells or neurons produce an important brain chemical known as
dopamine.
dopamine. When the
neuron
neurons die or become impaired, they produce
less
less dopamine, which causes the movement problems of Parkinson's.
Parkinson's. Scientists
Now,
still
scientists still do not know what causes cells that produce dopamine to die. So this is another
people
one,
with Parkinson's
idiopathic situation, right?
that produce.
Why is most disease that to do with the
What's
brain?
norepinephrine?
Because brain cells do not regenerate.
Norepinephrine.
None?
Norepinephrine.
For instance, when you look at clinical death by biological death, like when the guy got the man put his foot in his man's neck, enough oxygen was not going because the blood was not taking it. Brain died. And when the brain died, that was clinical death. And now anything between after that 4 minutes, it now becomes biological death.
Mm-hmm.
Now, if you know persons who had
What's epinephrine?
head injuries and they had TBI, you'll find that they are affected for life. The
Head
only find
injury.
person with TBI come back and be normal.
Mm.
Like you see those guys who went to Iraq and what have you, and they get injured, they come back and they try to bring them back to some standard of living, but they still remain very what? Impaired.
Mm-hmm.
Okay? All right, let's move on. Scientists do not know what causes cells that produce dopamine to die.
Where are we?
Now look at where the dopamine basal ganglia is at. Now people with Parkinson's also lose the nerve endings that produce norepinephrine,
The main chemical messenger of the sympathetic nervous system,
which controls many functions of the body, such as heart rate and blood pressure. Now,
What's that?
you guys okay?
Mm-hmm.
Please.
Apologies.
All right? The loss of norepinephrine might help
Apologies,
explain
FA.
some of the non-movement features of Parkinson's, such as fatigue,
Mm-hmm.
irregular blood pressure, decreased movement of food through
Got
the
it.
digestive tract, and sudden drop in blood pressure when a person stands up from a sitting or lying down position.
Mm-hmm.
Many brain cells of people with Parkinson's contain Lewy bodies or usual clumps of the protein alpha-synuclein. Scientists are trying to better understand the normal and abnormal functions of alpha-synuclein and its relationship to genetic mutation and impact of Parkinson's disease and
Lewy body dementia.
All right, not going all that way. Let's just go to basically just want you to understand.
What about the symptoms? We want to talk about the
Let's go into the symptoms. Perhaps 4 main symptoms:
Tremors,
trembling in the
trembling
hands,
arm,
arms, legs, jaw, or head. Stiffness of the limbs and
Limb and
trunk.
trunk.
Slowness of movement. Impaired
balance and
coordination,
coordination,
sometimes leading
into
to
fall,
Other
precaution,
symptoms may include
depression and other emotional changes, difficulty swallowing, chewing, and speaking,
urinary
problems or constipation, skin problems, and sleep disruptions.
Symptoms of
Parkinson's
Parkinson's
disease
and the rate of
and the rate of
progression
progression
differ
differs
among
among
individuals.
individuals.
Sometimes people dismiss
Early symptoms of Parkinson's as the effect
of
normal aging.
Normal aging. In most
In most
cases,
cases,
there are no medical tests
tests
to definitively
definitively
detect the disease, so it can be difficult to diagnose
accurately.
accurately.
Early
Like all
symptoms.
diseases, right?
Yeah.
It's so difficult to diagnose them.
Mm-hmm.
Now, early symptoms of Parkinson's disease are subtle and occur gradually. For example, affected people may feel mild tremors and have difficulty getting out of a chair. They may know that they speak too slowly or that their handwriting is slow and looks cramped or small. Friends or family members may be forced to notice changes in someone with early Parkinson's. They may see that the person's face lacks expression and animation, or that the person does not move an arm or leg normally. People with Parkinson's often develop Parkinson's that includes a tendency to lean forward, small quick steps as if they're hurrying forward, and reduced swinging of their arms. They may also have trouble initiating or continuing movement. And if you notice, when you guys do like the type of thing, if you notice they're starting the movement, initiating, they'll be like, and that's initiating. That's where the initiating movement, they have that problem, they'll be like, and then when they know they want to get the movement, they're gonna, right? But you see that hesitancy when you're initiating the movement, and that's a typical sign of Parkinson's. All right?
Muhammad Ali had that, right?
They all have trouble initiate all that. Some centers often begin on one side or even on one limb on one side of the body. As the disease progresses, eventually affects both sides. However, the symptoms may still be more severe on one side than on the other. Many people with Parkinson's note that prior to experiencing symptoms and tremors, they had sleep problems, constipation, decreased ability to smell, and restless legs.
Restless legs. Like Pharrell.
Really?
Restless legs.
It's a habit.
I'm just saying, just looking at Pharrell's leg, and you get an idea what it's like. I'm not saying she have it.
No, that's not what we're saying.
That is like a symptom of it.
That's not what we're saying.
He said, look at the legs. So
Just the
look.
leg, like the legs.
Hey, stop. I didn't
Nice
tell you to
legs.
look at the story. Let me stop, go back. There's sexual harassment will tell you guys to look at your legs. Now, diagnosis of Parkinson's disease, a number of disorders can cause symptoms similar to those of Parkinson's, and that's why we talk about differential diagnosis. People with Parkinson's, like symptoms that result from other causes, are sometimes said to have Parkinsonism. While these disorders initially may be diagnosed as Parkinson's, certain medical tests as well as response to drug treatment may help to distinguish them from Parkinson's. Since many other diseases have similar features but require different treatment, it's important to make an exact diagnosis as soon as possible. Now, there are currently no blood or lab tests to diagnose non-genetic cause of Parkinson's disease. Diagnosis is based on the person's medical history and a neurological examination. Improvement after initiating medication is another important hallmark of Parkinson's disease. Now, treatment. Although there is no cure for Parkinson's disease, medicine, surgical treatments, and other therapies can often relieve some symptoms. Now, the medicines of Parkinson's disease. Medicines prescribed for Parkinson's include drugs that increase the level of dopamine in the brain. That's where you're going to have the L-Dopa, right?
Yeah.
Levodopa. Drugs that affect other brain chemicals in the body, and drugs that help control non-motor symptoms. Now, the main therapy for Parkinson's is levodopa, also called L-Dopa. Nerve cells use levodopa to make dopamine to replenish the brain's dwindling supply. Now, usually people take levodopa along with other medications called carbidopa. Now, carbidopa prevents or reduces some of the effects of the levodopa therapy, such as nausea, vomiting, low pressure, and restlessness, and reduces the amount of levodopa due to improve symptoms. So they go hand in hand. You use the levodopa so that you can get the dopamine production, but the levodopa itself can give you side effects, and this is when you're going to do the carbidopa to combat those effects. Are you guys with me?
Yes.
All right. Yes.
Why sometimes I see some patients in the nursing home and they sleep late?
Go on.
They doing this. Is it?
They bored.
No. No. It's not because they bored.
They're rocking. They just be rocking, right?
That diagnosis with
Yeah.
Parkinson's disease.
When you have people who have neurological disorders, right, like what we're talking about right now, there's a neuromuscular disorder, can have some problems. And when persons have mental diseases, you might see some persons who be like this, and they're in the mental, in the unit with person with dementia or something, and they rock. It's like rocking for comfort. They rock themselves. They trying to get that comfort. They're rocking and they're rocking and they're rocking. And they're by themselves, or they're talking to themselves, or they're rocking. That comfort type of thing. All right?
Yes, because
All right. One of the good things I can say, or what I should say, sorry, is that when you are working, like you're working with patients who you know have these symptoms, it's a plus for you. Because a lot of things that people are talking about, and when they go to nursing schools, they may never see it. Because when they go for clinicals, if they don't have such a patient at that place,
they don't
get it. They will not experience what it's like. So take the opportunities now when you're working, and when you see a patient coming, especially a patient who has a disease that it's not like normally there, you just follow up on them. See what is their The medications are being used. See what is in nursing. If they do they allow the CNAs to go to the care plans?
No.
No,
No, of course not.
I remember.
What about the HIPAA law?
No.
CNAs are the primary caregivers of
Especially the
facilities.
nurses, some
Help-
nurses will not say
Help
anything to you.
the CNAs attend the meetings, the care plan meetings. And everything is ready at the care plan meeting.
Yes, if they
So the
give the
CNA
patient
come to the
notes,
care plan
sometimes they're
meeting?
not even
Of
giving
Yeah,
course,
some of
CNAs
them, yeah,
supposed to go
Parker
to
used
care
to
plan
do
meeting, but
Yes.
what they do, a lot of times the CNAs
They have a-
don't get to go to the care plan meeting because they're too short.
They don't put them in the.
And two, which is bad, because you need to get the viewpoints of the entire healthcare team.
Mm-hmm.
And the CNA is the primary caregiver. And the CNA is supposed to be in the care plan meetings. But they're gonna tell you up front, no, they can't pay CNAs to be sitting down, they need to go clean patients, which is totally wrong. And that's one of the things I have always had a concern with. And I will tell
It's best
persons,
for
but
us
then
to-
the CNAs themselves say, I don't want to know damn care plan meeting. I got enough work to do, and you don't tell me to go to care plan meeting.
I tell them
So
they
that-
read big book,
That
I
there's a
don't
big
read big
problem
book.
itself, so.
You do your job.
It is not just the facility alone, administration that will have a problem, but the CNAs themselves will say, I ain't doing it. And I know because I have tried that with many facilities. And the CNA will say, Mr. Wells, come on, I like you, but guess what? I don't like what you're doing.
Too much patient, they would say
Can't
too
do
much
this,
patient.
so it's like,
Less responsibility.
say again?
Less responsibility.
It's your responsibility very soon.
Hold on.
So
Yes.
you need to get
Now
it
it's
there.
gonna be my responsibility.
Because now you need to talk with your CNAs. Because when you're writing the care plan, you gotta talk to CNAs. If your nurses don't talk to you, but the patients, then I don't know what kind of care plan you're developing.
They just send
No,
you
they
to
just
another
put-
CNA.
Question.
No, they just put it in the computer. They put everything that the patient
Is
needs
that
in
question or something as far
the
as?
care plan.
No.
It's just like,
They
oh,
put the
she's
care plan in the
regular here,
computer
go
and
ask
my
her.
Yeah, go ask
This
her.
one's regular, go ask
Go
her.
ask her. They don't say anything.
Listen, the process is being broken down, especially since with this pandemic.
Wow.
And it's caused a lot of changes. And I know, I was actually talking to someone, not last night, the night before, and that person is a healthcare professional too. And I was saying that, a lot of these situations is happening in nursing homes, in hospitals, and on the streets. It's related to this COVID-19. That's what
Yes.
I'm trying to,
Uh-huh.
I want you guys to see how the COVID-19 can affect the brains. There's some,
The
these Chinese are
epidemic
looking at
killed
it, and they're coming up with, people are getting mental status changes. And I really do believe, I seriously do believe,
Oh yes.
that a lot of these shootings that is happening
It's
is
because of
because
that.
these guys have lost their
parents.
reasoning ability. They got a gun,
Uh-huh.
and then before they would have said, man, not thinking just, just scare the person or find someone that we're dealing with. First thing will come, shoot.
you.
Person on the sub, look how many people recently have been pushed on the train.
Oh my goodness.
Too
Yeah.
many.
So many.
Since this
That's
thing
what
started,
Yeah.
look at the amount of people, every week you hear people getting stuff pushed.
Mr. West, when the pandemic, I was depressed because every day I go to work, I'm afraid to pick up the disease in my job. When I come home and then every day I see a lot of bodies to carry.
Right, that's being scared of the death and dying. But what I'm saying is that the COVID virus
Yes.
can affect the brain. And I think that's what has been causing a lot. And these Chinese are doing some research that you just saw, and they're coming up with this possibility that it's causing people, because I already said that people are losing their memory.
Yep.
People are finding it very hard to retain stuff. But I really do believe all of these shootings that have been increased now, and all these pushing on the train and people hitting people in the streets, just walking up a person. I'm thought yesterday at 12:30 in the morning, a guy killed another guy.
What about a guy that was in a wheelchair?
And they had and it's unwritten, nothing they could find the reason why it was done. Imagine somebody just while you walk in the street, somebody just come push a knife in your throat.
That memory loss is real bad.
I was looking at
That's
the
not
news. The
remember
guy
loss,
was
it's
in a
loss of
wheelchair.
ignition,
Real
loss
bad.
of the ability to
Two men,
make decisions, and that's bad. And
So I gotta take
one
this
of the things
to my
that you
test
guys
again.
need to do as nurses is live in your own environment, because you know that students have been committing suicide because they can't interact. Lots of young kids are doing this, right? But look at situations around you. Sometimes the person that you live with might have had the COVID-19, and they are not making certain sound decisions. Maybe they argue with you more. Maybe they're doing things that you like. Why are you behaving like this?
A
But
lot
that
of
could
nurses
possibly
sick
be a change that is happening to that person.
They
Right?
say
So please, just use that as a guide, not to push your fingers and everything. So Parkinson's disease, as you see, and here, everything is about muscles and body movements and all that sort, and you know how your ADPI is going to be when you do all of these. Now, Huntington's disease. Now, this is where we go into the genetics. So what is Huntington's disease? Come on. This is what you guys were supposed to be reading last night. Talk to me about Huntington's. Okay, I give you guys things to read and
Define Huntington's disease.
Inherited disease.
It is a hereditary disease marked by degeneration of the brain cells and causing chorea and progressive dementia. Well,
It's breakdown, degeneration of nerve cell in the brain.
Now, what's the age groups?
30s and from the 30s to the 40s.
What's the life expectancy?
For a person with Huntington's disease,
What's the life expectancy, guys?
10 to 20 years after the onset.
it varies.
The set 30s, 40s. From the 30s.
Say 30 and 50, and can show up as early as 2 years of age,
Or 80 years of age?
or as late as 80. We on the same website?
It's up here.
And then the symptoms include
The lights.
abnormality walking,
Can't see with the light though. Can't see that well. Can't see that well.
Turn left, sir.
Please.
Person can see. I had the opportunity many years ago of nursing a person with Huntington's disease. That was maybe about 20 years ago. And what was very sad about this situation was that she was young. She was very young. And she was white, of course. We're going to see the incidence of it is Caucasians. She had a son. And he was like 18, 19. But during the time in the Bronx, it was a time of drugs and AIDS and that sort of stuff at that time. And he used to come every single day and wash his mother up, including her vaginal area. He come and he clean his mother up every single day. And then she had some tattoos, because at that time tattoos a big thing. And he went through the pain to try to get the tattoos off, because he knew that his mother's going to die and she never liked the tattoos. so he tried to do whatever he could to please her. And she had these uncontrolled movements. She couldn't move. She's just like that in the bed all the time until she passed away. And that's the first and only time I've ever seen Huntington's disease. And I see the anguish it could cause. The only child, her son, and used to come Bobby. Bobby would come in and Bobby would clean his mother up. And the CNAs and nurses say, oh, we go clean his mother private parts. But he would clean his mother.
That's his mother.
Take care of her. Take care of her. Many days you see he'd be sitting there crying. And he's come outside because he don't want her to see him crying. And this is a burly guy, big, strong, white guy. And then he had all these things on his hands where he plaster or bandages. Because he's trying to, not like today in technology, they use things now to get rid of it. Back in the days, it's like a horrible thing to get it off. And so he was going through all of that. And that's to show you how disease can not only affect the person, but the persons who are
And the family too.
who are related to them, be it family, friends, whoever it is. And that there was kind of sad when you look it over the years. Now that was this here was different from the others. This one here is strictly what? Genetics. All right? This is only genetics. And can happen as far as they're concerned anytime. As a child or as an old person. And all these, what we've been looking at, we've been saying that the CNS diseases are all progressive. They just get what? Worse. The PNS, you can work with these people. But the CNS,
You can.
Can't really do much.
Can't really do.
so when you categorize your CNS, the central nervous system, you should be looking at right away weakness, paralysis, slurred speech, anything that's affecting your neuromuscular. If the nerves are damaged, the muscles. Remember you did your 12 cranial nerves, right?
Yes.
I remember the sensory and the motor and the both. Each one of them got a job they had to do. And these jobs are what is being affected because a part of the brain are being affected. You guys with it?
Yeah.
Okay. Close your laptops, man. Close your laptops.
Yeah.
Turn on the lights. I want, close your laptops, close your books, close everything, put away everything.